Obesity is a complex health issue that affects millions of people worldwide, characterized by excessive body fat that can have negative effects on health. It is not simply a matter of overeating or lack of willpower. Obesity is often influenced by various factors, including genetics, environment, lifestyle, and emotional well-being. Understanding these factors and the impact of obesity is key to finding sustainable solutions. 1. The causes of obesity. Obesity develops over time, typically as a result of a combination of different causes. Genetic predisposition. Genetics play a significant role in obesity. Some people inherit a tendency to gain weight easily or store fat more efficiently than others. Family history of obesity increases the likelihood of developing the condition. Lifestyle and behavior. Unhealthy eating patterns, such as consuming high-calorie, low-nutrient foods, fast food, sugary snacks, and processed foods, and a sedentary lifestyle contribute to weight gain. Physical inactivity, often a result of modern conveniences like cars and technology, makes it easier to accumulate fat. Psychological factors. Emotional issues like stress, depression, or anxiety can lead to overeating or eating unhealthy foods for comfort. Eating in response to emotions rather than hunger is a common issue linked to obesity. Environmental influences. The environment plays a huge role in shaping eating habits. The easy availability of processed and high-calorie foods, combined with busy lifestyles that limit time for cooking or exercise, can promote weight gain. Medical conditions and medications. Certain medical conditions, such as hypothyroidism, polycystic ovary syndrome, PCOS, and metabolic disorders, can contribute to obesity. Additionally, medications like antidepressants, steroids, and diabetes drugs may cause weight gain. 2. The health risks associated with obesity. Obesity is not just a cosmetic issue. It significantly raises the risk of various serious health conditions. Heart disease. Obesity increases the risk of cardiovascular diseases such as heart attacks, high blood pressure, and stroke. Excess body fat leads to high cholesterol levels and inflammation, which contribute to heart problems. Type 2 diabetes. People with obesity are more likely to develop insulin resistance, leading to type 2 diabetes. This condition can cause long-term complications like kidney disease, nerve damage, and vision problems. Joint problems. Carrying extra weight places strain on the joints, especially the knees and hips, leading to conditions like osteoarthritis. This can result in chronic pain and reduced mobility. Respiratory issues. Obesity can lead to breathing problems, such as sleep apnea, where breathing repeatedly stops and starts during sleep. It can also exacerbate asthma and other respiratory conditions. Mental health impact. The psychological effects of obesity include low self-esteem, depression, and social isolation. The stigma attached to being overweight often leads to discrimination, which can worsen mental health conditions. 3. The emotional and social aspects of obesity. For many people, obesity is deeply tied to their emotional and social lives. Feelings of shame, guilt, or failure can accompany weight gain, making it difficult to seek help or feel confident in efforts to lose weight. Body image. Society often promotes unrealistic body standards, leading individuals with obesity to experience negative body image. This can impact self-worth and fuel a cycle of unhealthy eating patterns as a coping mechanism. Social stigma. Weight bias and fat shaming are pervasive, especially in media. These negative attitudes can result in bullying, discrimination in the workplace, or unfair treatment in medical settings. 4. Pathways to overcome obesity. Effective treatment and prevention of obesity involve a multifaceted approach that addresses both physical and mental health. Balanced diet. A well-rounded diet that emphasizes whole foods like fruits, vegetables, lean proteins, and whole grains is essential. Reducing the intake of processed foods, sugar, and unhealthy fats helps prevent weight gain. Physical activity. Regular exercise is a critical component of managing obesity. Activities like walking, swimming, or strength training improve metabolic health and help burn calories. Small, manageable changes in daily activity, such as taking stairs or walking short distances, can be effective for long-term results. Mindful eating. Developing a healthy relationship with food is essential for sustainable weight loss. Mindful eating practices like listening to hunger cues, eating slowly, and avoiding distractions can help prevent overeating. Behavioral support. Therapy or counseling can address the psychological aspects of obesity. Cognitive behavioral therapy, CBT, can help identify unhealthy thought patterns related to food and body image, making it easier to adopt healthier behaviors. Medical interventions. In some cases, medical treatment is necessary. This may include prescription medications to reduce appetite or increase metabolism, or weight loss surgery, bariatric surgery, in severe cases. 5. The role of self-love and support. Overcoming obesity requires compassion, patience, and a strong support system. The journey to a healthier weight is not about perfection but about making gradual, positive changes. Self-love is crucial in this process, as focusing on small victories and maintaining a positive mindset can boost motivation. Support networks. Family, friends, or support groups provide the encouragement needed to stay consistent with healthy habits. Sharing experiences with others who understand the challenges of obesity can offer emotional relief and practical advice. Holistic approach. Successful weight management often requires addressing all aspects of health, including emotional well-being. Engaging in relaxing activities, such as yoga, meditation, or hobbies, helps reduce stress and prevent emotional eating. 6. Final thoughts on obesity. Obesity is a complex issue with wide-ranging effects on physical, emotional, and social health. By focusing on sustainable lifestyle changes, addressing the root causes, and seeking support, individuals can overcome the challenges of obesity. Healing is not just about weight loss but about improving overall quality of life. Every step toward health, no matter how small, is a victory worth celebrating. Obesity is far more than a mere physical condition. It is a multifaceted issue that touches on every aspect of life, from physical health to emotional well-being, and even social interactions. The complexity of obesity stems from the intricate interplay of genetic, environmental, psychological, and lifestyle factors, making it a condition that requires more than a one-size-fits-all approach. To truly address obesity, we must look beyond simple diet plans or exercise routines and recognize the deeper, underlying causes and the individual challenges each person faces on their journey to health. First and foremost, understanding that obesity is not solely the result of poor choices or lack of discipline is key to breaking down the stigma and shame often associated with the condition. Many people struggling with obesity deal with hereditary factors, emotional issues like stress or trauma, or medical conditions that make it harder to maintain a healthy weight. In this context, it's important to approach obesity with empathy, both for ourselves and others, acknowledging that weight is not a sole measure of worth or success. The health risks linked to obesity, such as heart disease, diabetes, joint problems, and respiratory issues, are significant, but they are also preventable and, in many cases, reversible. Tackling these risks involves adopting a well-rounded, sustainable lifestyle. Changes to diet and physical activity are essential, but they should be implemented with a focus on long-term well-being rather than short-term results. This means embracing balanced eating habits, finding enjoyable forms of exercise, and making mindful decisions about food and activity levels, all while staying patient and consistent with the process. Mental health plays an equally important role in the journey to overcoming obesity. Emotional eating, body image issues, and the stigma associated with being overweight can create significant psychological barriers. Healing requires more than just physical efforts. It also involves addressing the mind and emotions. Whether through therapy, counseling, or personal reflection, it's crucial to uncover the emotional triggers behind unhealthy behaviors and to cultivate self-love and acceptance. In doing so, individuals can break the cycles of guilt and shame that often accompany weight struggles, allowing them to make healthier choices without the burden of negative self-judgment. Medical interventions and professional support can also be life-changing for many who struggle with obesity. Medications, surgery, and other treatments provide options for those who may find it difficult to lose weight through lifestyle changes alone. Consulting healthcare professionals, seeking counseling, and joining support groups all contribute to creating an informed, supportive environment where long-term success becomes more achievable. However, perhaps the most important element in overcoming obesity is cultivating a deep sense of self-compassion and resilience. This journey requires patience, because weight loss and overall health improvement are gradual processes. By celebrating small victories, staying focused on the broader goal of better health, and building a supportive network, individuals can foster the emotional strength needed to persist through challenges. Ultimately, obesity should be viewed through a lens of hope rather than despair. Each individual has the capacity to take control of their health and make positive, lasting changes. Whether through changes in diet, increased physical activity, mental health support, or medical assistance, there is always a path forward. The goal is not perfection, but progress, step by step, day by day, toward a life of greater vitality, well-being, and self-love. As we move toward healthier lifestyles, let us remember that the journey to overcoming obesity is deeply personal and should always be approached with kindness, patience, and a commitment to the whole self.